Bismillah ar-Rahman ar-Rahim. Now we'll discuss another lecture which is very specific and unique in the psychiatric chapters. I'm Dr. Ibraheem Hamdy, Assistant Professor of Psychiatry, and my special interest in forensic psychiatry. And I discuss with you last time the mental health law and the regulation of mental health law. My professors will discuss with you the issues of the general psychiatry, such as the psychiatric history and psychiatric interview. Also the chapters of the schizophrenia, chapters of the mood disorder, bipolar disorder, chapters of anxiety disorder, and chapter of the psychological treatment. Either the psychological treatment is psychiatric treatment or psychological psychotropics, also the psychotherapy and electroconvulsive therapy. Last time I discussed with you the mental health law. Mental health law is the law which regulate and manage all these issues with each other, with each other. Now, and very brief, we'll discuss a very important lecture also, which is related to the psychiatrist himself, and how the psychiatrist may face many challenges with the different culture of his patient. The main objective of this lecture: what is the cultural formulation of the mental illness? Number two, what is the cultural formulation of the mental illness? This is the main objective. The cultural formulation of the mental illness maintain many items. Some as the first point, which is the culture in the identity of the individual. Number two, the cultural explanation of the mental illness. Number three, the overall cultural assessment and diagnosis and care. Number four, what's called migration. Number five, what's called cultural bound syndrome. All of this talk means that to discuss the effect of the culture on the interpretation of the mental illness, we must study the cultural identity. We must study the cultural explanation of mental illness. We must study the cultural assessment for diagnosis and care, overall cultural assessment, and the issues of the migration, and the issues of the cultural bound, what's called cultural bound syndrome. What we'll discuss firstly is the cultural identity. What is the cultural identity? What is the cultural identity of the individual? The identity defines self-perception and self-definition among his group. Knowing the cultural identity of the individual allows the clinician to avoid the misconception of the patient. So what is the definition of the cultural? What is the definition of the cultural identity? The identity make a perception, make as a perception and the definition for me. Make a perception and the definition for me. But the culture make a perception and the definition of, because without culture, no perception and no definition for me. What are the point which determine this culture? Number one, race. Number two, ethnicity. Number three, socioeconomic status. Number four, language. All of these points determine the culture. The cultural identity, the identity which make perception and the definition for the person. What is the race? What is the definition of the race? Race means that certain special features for the person, or certain facial characteristic for the person. We have many races. We have the Asian race, we have the black race, we have a Caucasian race. If these races have a one culture, no, it has a different and variable culture. We are Egyptian. We are related to the Asian or the black or Caucasian. No, we are related to the Caucasian culture. Regarding this race, possession accepted in our culture, but not accepted in European culture. We are Egyptian and Arab persons, and European also are Caucasian. We are Caucasian, and European also are Caucasian. Possession, possession accepted in our culture, possession accepted in our culture. Accepted in European culture, not accepted in European culture. It's accepted in Asian and the black culture, it's accepted in Asian and black culture. So if the psychiatrist understands this point, he will not make he will not make misconception of the patient, because the possession may be considered normal in the Asian black race, and also in the Arab ethnicity. Caucasian people, Arab ethnicity, it's accepted, but in European culture, who are also Caucasian, not accepted. So this is the differentiation which the psychiatrist must know to prevent misconception, because some phenomena may be accepted in certain culture and may be not accepted. If not accepted, it will be a pathology. It will be considered a pathology. So possession may be considered a pathology in European culture, but will not be considered a pathology in Egyptian and in Asian and black races. What is called insanity? Insanity, it is the same as the race, but it is narrow than the race. We are, we are in Egypt, we are Egyptian people and Arab. We are Caucasian. European also are Caucasian. So insanity means that the same as the race, but narrow than the race. Insanity and the country of origin. Insanity and the country of origin. So we name the Caucasian culture or Caucasian race, European person and Arab person, and the Arab ethnicity. Arab ethnicity and the Arab country of origin, psychiatric disorder and personality disorder and the mental subnormality are not understood well, such as in Syria, which has unique culture from the unique culture different from the rest of Egypt. So regarding also the ethnicity, we are in Egypt, we are Egyptian and Arab. In Gulf area, they also are Arab, and but they are from different country or different ethnicities. The definition for psychiatric disorder and personality disorder may be different in Egypt from the Gulf area. Also inside Egypt itself. In Siwa, for example, the definition of the personality disorder and mental subnormality are not understood in Siwa. It's a special area in Egypt, but it will be understood well in the rest of Egypt. It's a geographical area, not different except social standard point of view. Another than Siwa, all of Egypt are not different from each other except the point of the social standard point of view and the level of economy of education. If the social point of view and the level of economy of education affect the interpretation of the psychiatric disorder, psychiatric need not affect except of the level and quality of the surface of the treatment. Some society consuming, which another point also for the difference in the culture, some societies such as the Russian and the Irish consume big amount of alcohol than other communities, and it's considered normal in comparison with other communities which consider this consumption of alcohol, huge or large amount of consumption, may be considered addiction or substance abuse, such as Egypt or Arab area, but in Russian or Irish, consumption of bigger amount of alcohol considered normal. So now we know that the race and the ethnicity and the geographical distribution and socio-economic level may affect the issue of the interpretation of the psychiatric disorder. Language if affect the cultural interpretation. Actually, some doctors in our Arabic country Arab community are not able to understand the English street language. Some Egyptian doctors meet some challenges during the start of their life in the United States till they master English. We also may meet or may make interview for some foreigner patient in Cairo, which has different language, such as French or Chinese people. We have many French and Chinese people in Cairo, psychiatric patients who are related to these nationalities. It will be a paraphrase psychiatrist or physician. Otherwise, translator is available. So, number one, cultural identity of the individual. This is the first point in the cultural formulation of the mental illness. What is number two? Cultural explanation of the mental illness. How to express the mental illness, how to express the stress. It means that each culture has its acceptable means for individual expression for the stress. And it's different from culture to another culture. What are acceptable meaning for this expression and what are ways for forms that consider illness? Psychosomatic symptom, very, very famous to find it in rural area, while depression happen in the urban area. With higher level of the education, so the psychiatrist must understand that the depression may express with a somatic symptom in the rural area. He may not understand this part. So this is the importance of culture. Some communities do not allow expression of the stress, such as Japanese. The issue is related to the work issue, to the work ethics. So the psychiatrist may make interviews with the patient who is ashamed to make expression of his stress. The difference between explanatory model between clinician and patient. So this difference, if the psychiatrist to know how the culture affects the experience of mental illness, this make a good rapport and will not lead to misdiagnosis. Number three, we enumerate the cultural identity. Number two, the cultural explanation of the individual stress. Number three, overall cultural assessment for diagnosis and care. Accepting the cultural difference makes the interview much easier by assessment different aspects of the interview, from the main complaint to the assessment of the conduct and the thought content. If you are a psychiatrist and you are interested and you stress in the point of the cultural identity and the race, ethnicity, and the language and socioeconomic status, and how to explain how the mental illness is be expressed and be explained, your overall cultural assessment, your service providing will be going in the right track. From also the point which affects the cultural formulation, cultural identity, cultural explanation of the mental illness, overall cultural assessment and care. What's called migration? What is a migration? Migration means that community migrate from culture to another culture. So we have 2 points, what's called host culture, number two, visitor culture. So there's two cultures, they are different from each other. So there's a difference between host and visitor culture. And there's also difference regarding the issue of socioeconomic status. Ability to blend with the host culture, this make protection for the ability of the blend, make this ability to blend with the host culture, make protection for the visitor person or the visitor community not affected with stress or psychiatric illness. For example, many migrated communities are widespread all over the world. From this community migrate further, such as Lebanese migrate in the early 20th century to South America, and Chinese in the United States, and Indian in England. These communities are very stressful, are very successful community. These are communities which migrate from their communities to another community. So they are visitor and they migrate to the another community is the host. These communities proving that very successful. So they are exposed to little stress burden because there is ability to blend with the host culture. What's happening in Egypt? Egyptian migrants are connected to their homeland. Our Egyptian migrants not make complete migration. What is specific in Egypt that they are connected to their homeland. Many psychiatrists notice some psychiatric disorder in Egyptian children and adolescents. This is a very important phenomena nowadays, because when the Egyptian return another time to their homeland, there is a certain maladjustment with the different lifestyle in Egypt in comparison to Gulf area. So some sort of environmental deprivation which may happen with some child and adolescents, and certain sort happen in the migrated community. Environmental deprivation because the lifestyle, for example, in Gulf area, it is related to the restricting to the work, not similar to the lifestyle in Egypt, which the people have more exposure to each other. So some sort of environmental deprivation happen in the some Gulf area. So some child and adolescent return to Egypt another time, exposed to environmental exposure not similar which was brought up there. So some sort of maladjustment happen due to the difference between the two cultures. Cultural bound syndrome. So we spoke about the cultural formulation of mental illness, and this cultural formulation affects the interpretation of the psychiatrist of the mental illness and the expression of the patient of the mental illness. We discussed many points which include this cultural formulation, such as the cultural identity and cultural explanation of mental illness and overall cultural assessment, diagnosis and care, and migration, and what's called cultural bound syndrome. What's cultural bound syndrome? Cultural bound syndrome means some syndrome which are specified to certain communities and do not happen in another communities, such as in South Asia, what's called possession syndrome, and Latin America, which is called attique de nouveau. Some syndrome also, which are also possession syndrome, such as amok, happen in Philippines and Polynesia and some African countries. These syndromes are considered normal in their cultures, in their communities, but are considered some sort of pathology or psychiatric pathology in different communities and different cultures. These are the point of the cultural variation which affect the expression of the mental illness and affects the psychiatrist when he make interview with his patient. And I will meet you inshallah in another lecture. Thank you.